Hi, I'm Kate Shields. I'm the Chief Executive of Royal Cornwall Hospitals, and I've been asked to talk to you today about concerns that people have got around our maternity services, and in particular that they're not going back to business as usual, normal arrangements as quickly as people would like them to. I felt it was important that I explained to you personally why we've got the arrangements that we've got in place, and I hope that you'll understand after I've finished speaking with you why it's so important that we move quite slowly in terms of putting things back as they were before. So you'll know during the COVID time of being locked down that we drastically reduced the footfall on particularly the Chieft site, but also at St Michael's and at West Cornwall Hospital in Penzance. The reason for that is that the numbers of people that we have on the site in other parts of the country directly correlate to an increased transmission around COVID-19. We know the people that are on our sites are the most vulnerable and those at most risk of having serious complications of COVID. So we tried really hard to keep our sites as quiet as possible, and we asked people to use general practice and to use minor injury units rather than coming into our A&E department. Although we've started getting some things back to normal, we are still struggling to make sure that we can look after everybody in safe places. So if we think you've got a diagnosis, you'll go into an amber area. If we think you're COVID free, you'll go into a green area. And if we know you've got COVID, you'll be in a red area. That means that we can look after everybody, people who come to be cared for here, and also people who work here, because people who work here could asymptomatically carry COVID and spread it to other people, other vulnerable people, without knowing they're doing so. In our maternity services, we are still saying that if a woman is having a scan or an outpatient appointment or a procedure in the antenatal period, that they need to come on their own without a visitor. Now, I know that is really traumatic. Our own chief nurse, Kim O'Keefe, her daughter had a baby during COVID. Kim didn't see the baby on the postnatal ward, and her daughter had all of her outpatient appointments without her partner being with her. We know that sometimes outpatient appointments are traumatic and worrying and that people are anxious, and we do our best to comfort and to look after you, but also we know that not having a partner or a birthing partner with you is really difficult. And we don't do it lightly. Once we start turning on a visitor being with a woman when she comes in for an antenatal or a postnatal check, we'd need to do the same for our cancer patients, or for our haematology patients, or for our renal patients. And we can't afford to increase the footfall on this site at this point. So we don't want you to feel that we're being really restrictive, and we would like to celebrate the choice that our midwives have given women while they've been pregnant during the COVID period and giving birth. We haven't restricted any choice around birth at home, in our birthing centres, or coming into the main Chieft site. We're trying really hard to work closely with our Maternity Voices partnership as the place where women give feedback around the care that they receive and the appropriate challenge that they give us to make sure that we are trying as hard as we can to make sure that the service we offer you meets your needs and the needs of your family during your period of antenatal, birth and postnatal care. So I know many of you will probably still be disappointed with this message. I just want you to know we are doing this for all the right reasons. We will try really hard with videos of scans. We're looking at digital enablement to see if there's any way Google Glasses could be used so that partners could see the scan at the same time as mothers being scanned. We will do anything we can, but our absolute commitment is to making sure that we safely care for women, their babies and your families during the time of your care with us in our maternity services. All of our midwives, all of our obstetricians are focused around the safe delivery of babies and the safe care for mother and child. If at the end of this any of you have any questions or queries, please don't hesitate to contact us, and we will do what we can to help you feel less anxious, cared for, and most importantly, involved in the care of yourselves and your babies. Thank you.